When I was going through the egg freezing process, I found the medical lingo that was thrown around utterly confusing. So I decided to bring in somebody to put this all into place. So Manny, what are the most common acronyms that people might hear and what do they actually mean?
I'll try and shed some light on this for you. So as a fertility specialist, the most common acronyms that I hear would be OI, IUI, IVF and ICSI. Now I understand they're quite confusing. So with OI, for example, it's ovulation induction. Now, ovulation induction is used mainly to help a woman ovulate. Now, moving along the process then is IUI. That is intrauterine insemination. Now, intrauterine insemination is where we process sperm and literally place it into a woman's uterus.
So the helping hand to the birds and the bees.
Yes, and that occurs just prior to ovulation. The next treatment that we offer is IVF, and that's in vitro fertilization.
Which is probably the most common that people do hear about.
True. In vitro fertilization is where we give the woman medication to stimulate growth of follicles that contain eggs, and we rescue the cohort that she had for the month. We collect those eggs before she ovulates, and then it's what we do with the sperm that we've got that decides whether it's IVF or ICSI, which is intracytoplasmic sperm injection.
The tongue twister.
That's right.
Okay, so now that we've worked out some of the acronyms, if a couple or an individual is finding it all very daunting when they're in the surgery room with the doctor, how do you suggest that they facilitate these conversations and what questions do you think they should ask?
My biggest word of advice is ask questions, don't be afraid. We're not scary people generally, and that often gives them a much more positive experience.